Hello there to all my followers all across the world. My name is Miss B. Welcome to the seventh podcast of the Talking Drum Show. This is the seventh podcast of the Talking Drum Show. If you're in Africa, I say to you, Akwaba, Jua, welcome to the seventh podcast of the Talking Drum Show. I'm so excited. So this topic is a very, very intriguing one. Very, very interesting topic. We all Before I proceed, please, to my subscribers, I want to say thank you for subscribing to this podcast, to this show. Please, those of you that are following, please do the show some justice, some help by subscribing. Just hit the subscribing button and subscribe to this show. It's here to stay. Every Saturday we bring you very, very interesting topics that's gonna be helpful to you in so many ways. So please be a part of this team. Hit the subscribe button and join us. And also, right now, if you're a subscriber, if you're following, please do the. You can help the show in so many ways. You can share, you can subscribe, you can participate by commenting, you can donate through stars, or you can just write reviews. We will appreciate that. So please do the right thing and subscribe. Today's topic is mental health awareness. Mental health awareness. How many of us are aware about our mental health? We have environmental health, we have physical health, we have mental health, which also falls on the emotional health, which also falls on the mental health. And we have social health, and also we have spiritual health. How healthy are you? How aware or informed are you about your health? Today's topic is going to be on mental health. How aware are you of your health? With me to discuss this very, very important topic is my friend, a sister, a mother. Her name is Miss Emerus King. Miss Emerus King is a renowned, it's a trained medical mental health practitioner. Okay, she has a degree in mental health, and she's going to come on here tonight to give us professional, in-depth knowledge on what mental health awareness is all about. I'm going to bring her on now and welcome her to the show. Hello there to my beautiful sister, Miss Emerence King. Welcome to the show.
Hello, thank you for having me.
Good. How are you doing today?
I'm great, thank you. How are,
That's
how
awesome.
are you?
I'm doing good.
Okay.
Please introduce yourself to my followers. Who is Miss Emerence King?
First of all, I'm a Christian. I'm a wife and I'm a mother, and I'm fascinated by mental health due to personal reasons. And I started studying mental health after a loss of a child, of my oldest child. So it's just helped just to understand what goes on, and it helped me grieve, and it also allows me to help others.
Awesome. That's interesting to know. We're gonna thank you for accepting to do this, Miss Emerence. Thank you. The tradition here is to ask you 10 questions, and then you will answer the questions. And after each question, if there's a follow-up question, I'm going to ask you a follow-up question. We're going
Okay.
to jump right into it, okay? I see you have
Okay.
two master's degree in mental health. Before we proceed with the questions, can you tell us what the degree in neuro-linguistic programming is all about?
Well, neurolinguistic programming is like it's a natural language processing. It's a
Hmm.
more of a natural way of helping people to achieve what the brain desires or what the brain result is supposed to be, compared to therapy. With therapy things, it's more like therapy may take longer, but by doing neurolinguistic programming, results are faster. Of course, some people don't believe in that, but because they think, oh, it's a hacks and things like that. But it's just a process where you just retrain your brain. And then let's say that you cannot change the events that happen in your life, the trauma that happened in your life, but you can change the way you think about it now and in the future. So I think that's
Interesting.
the goal. That's what intrigued me about it. That's the reason why I loved it so much.
Good, good. Wow, we got a very, very trained professional guest today in the field of mental health. We're going to jump right into it, my dear sister. Question number one. Let me ask you directly, my sister. What is mental health all about from a professional point of view?
Where it includes emotional, psychological, and social well-being, and it affects how we think and how we feel and how we act. And it's very important, and it's important from the stage of childhood, adolescence, and adulthood. And we should really really pay attention to what goes on in our life and the changes that may affect our moods and everything else that relates to our life. And
Yes.
mental health help us mental health help us to handle the stress and to relate to others and make healthy changes. So
Oh, nice.
it's important.
Good. Good to know that. So even as a child, one should be concerned about their mental health from your
Yes,
responses.
it
Good.
is.
Good.
And yeah, it's a part of mental health is part of everyone, something to look after. It's real and complex. It's really important. It's something we can change. So it's very important to to pay attention, you know to everything
Yes.
that goes on, because the earlier you can see all the issues going on or all the changes, the earlier you can take care of it and deal with it. And
Good.
yeah, mental health, it's not a sign of weakness. It's not all in your head. It's something that you cannot just snap out of it. So it's important. It's not always a negative thing. And it's sometimes, like, it's not something you should be ashamed of. So it's very important to seek help
Good.
whenever needed.
Good. Question number two. What are some of the factors that causes mental health illness? Are there early signs and symptoms? Can a person be somewhat mentally ill and not know it?
Yes, I think biological factors of chemical imbalances in the brain are the one that start affecting the mental health. And sometimes it's also depend on genes, like the family history, childhood abuse or trauma, social isolation or loneliness, just social disadvantages. I think it's everything that can just bring stress in life, because things as even just the lack of sleep, you know, will can affect your mental health. So
So from what you're saying, it's kind of a little bit complex and more deep. So what are some of the signs can you see in a person to know they have some form of mental health disability or illness?
where it's withdrawal, like sometimes people with withdrawal, and some people with just decrease in the, like, a lot of them, most of the time you would just by looking at a person you can just know that they have mood changes, highs and lows, and they isolate themselves, and they
Okay.
just they're just not themselves. They're not the usual self. So
Right. They withdraw from their daily or their friends or community. They just want to isolate themselves. And that could
yes.
be a sign. Okay. That's good answer. Number three, that's interesting response. How are people clinically diagnosed with a mental health illness? It is also considered, is mental health also considered a disability in the US or from your training?
Well, it is it's diagnosed by doing like full evaluation. You know, you have to go and just ask a whole bunch of questions, try to figure out your background and experiences to look at, and then they look at all the grouping of your emotions, your feelings, your behavior, and physical symptoms, and
Hmm.
how that impact your life. And it's also you know, the diagnosis may also include blood work and neurological testing. Medical history is also looked at, and it's interesting because sometimes different culture
Hmm.
and different culture and background may express mental health differently, and that's really always important, interesting.
So a culture, uh, when you say different culture can affect, how can you elaborate a little bit on that? How does a person's culture affects their mental health?
I
That's a
think
good.
because of the environmental, and I think it's just like it's important to be connected to others, and in
Hmm.
some cultures people spend a lot of time together, and in others they stuck more like one on one. So I think
Yeah.
by just being together, supporting each other, it affects the way we feel, because
Okay.
nobody wants to deal with mental health alone, and it helps a lot.
Got you. Got you. So if you find yourself in a place where you don't feel y- the ability to connect with people is very diminished or not there, it affects your mental health situation if you're not connecting with people or not socializing or not be able to have. Is that where we're getting with the cultural thing?
Well, I think if you spend time
Hmm.
alone, for if you stay somewhere alone for a long time,
Hmm.
it's going to start affecting your feelings and your mood and everything else. We need each other in
Okay.
order to be
Hmm.
mentally balanced.
That's interesting. That's interesting.
Yes, and the
So,
term mental health implies the absence of illness or disorder. You know,
so
a lot of the people with mental health do not think that they have mental health, of course, you know, but it's just important for the people around them, you know, to kind of help, and then just, you know, talk about it and just questions.
that's intriguing. That's intriguing. I see. So that takes us to question number four. What are some of the treatments or therapy for folks diagnosed with mental health? How do you diagnose? How do you treat mental health after they've been diagnosed?
But there are psychotherapy, you can use, you know, therapy,
Mm.
psychotherapy, which is a therapeutic treatment of mental illness, and it provided by, you know, it provided by a mental health professional. Sorry. And psychotherapy explores thoughts, feelings, and behaviors, and seeks to improve the individual's well-being. And then you can also pair that with medication. And
Okay.
some people, they go more with the traditional, you know, side of it, like yoga, meditation, you know, if you're a believer, you know, of course, prayers and things like that. So
Those are the forms. So they're actually medications are put on to help with mental health,
yes,
like you
it
just
depends
said.
what you, yes, it depends what you're dealing with. Some of that you need medication, you know,
Hmm.
and you have to pair that with therapy, psychotherapy. In some instance, you just need therapy. So it just depends of what you're dealing with.
Okay.
And I know sometimes people think that, oh, those medication is just too much, but it's sometimes it's really important for somebody to take it. And once you take it, you have to continue taking it until you don't need it anymore. But don't just take it today and then tomorrow you don't, and then after that you do, because that will really affect your moods. uh,
Interesting. Very interesting. This brings us to another intriguing question. Question number 5. In Africa, it is common to see lunatics or mentally disturbed persons wandering the streets, usually abandoned by family and their community. While in the West, you see when you see a mentally person on the streets, the state or local police will arrest them, take them to a mentally, rehab facility. So my question here is, what are the stages of mental health, and are all those stages treatable? For example, a person like I said in Africa that's wandering the streets, he's clearly gone mentally. He's gone. He's not there because you can see clearly he has no clothes on. Most instances he's just wearing his underwear, which is extremely dirty. His hair has grown. He's not bathed for months, and he's not harmful, but he sleeps on the streets, sleeps on the wayside, at that level, okay, at that level of mental illness, is it treatable? Can that person be cured? And also, what are the stages of mental health?
well, at first it just start mild, it just starts with like just showing some mental like symptoms, mild symptoms.
Mm-hmm.
And sometimes you can still function, you can still go to school, go to work, and just deal with your community. But then, but that's at the beginning, and then sometimes and then the second stages is like it increases, and it just well, you that's when the symptoms, the stages become more severe. That's when you really still need to seek help. But like I said, most of the time the person doesn't know that you know they're sick. So, and you talked about genetics and people in the street and things like that. I think those are mostly the final ones,
Okay, the
like
final
where,
stage. Right.
yes, like where they can't control themselves, they don't know what they're doing, they're just, some of them hear voices, and I mean, there's just a whole bunch of things that can apply to them. And it can be treatable. You just have to seek treatment. And that's the problem, though. You have to seek treatment, you
So at
know.
that level, it can be treated, and a person can come back to normal from that level of acute.
Well, it can be
Um,
managed. It can
it
be
can be
managed. It
managed.
depends. It depends what's going on, but it can be managed,
Okay.
through therapy, through medication, and whatever that can
Counseling.
help. Yeah, counseling. Yeah, it's
Wow,
just, yeah.
that's interesting. We're going to jump to question number 6. Um, there have been cases of mentally disturbed persons who have checked into rehab facilities or treatment facilities and became successful with their treatment. However, there have been several cases of relapse, relapse cases. What causes relapse after treatment? A person was found to be mentally ill, like a person from the street in Africa taken to a rehab facility, looked after, treated, went out through all the processes and released. Okay, released maybe a year in there, 2 years, whatever treatment they had to go through, they were released. But then after a while, they relapsed. What causes relapse as a professional mental health?
Well, what uh, relapse after treatment is caused by a new source of stress or old stress. Because if you then deal with the old stress, it will come back over and over again. Or sometimes it's just like I said earlier, just poor sleep. The lack of sleep. The lack of sleep can also just cause relapse. And also sometimes a loss or like a loss of a person, a loved one, or a thing, or this conflict with loved ones. So it's in general, stress can cause the relapse. So
Hmm.
it's good to stay balanced. If you can if you know the triggers, then you can really just follow that. But remove yourself from stress if possible. I know sometimes it's impossible. It's not that easy. But
It's almost impossible to live stress free in this world
well, but
today. A lot of
there's some
stress.
stress. There's some healthy stress, but there's also some stress that is just too much for a person to handle. And I think that's what we're really concerned about. Because there's
Do you?
some.
I have another follow-up. I'm sorry. It's very interesting for me, this topic. I have a family member that's struggling with a drug and alcohol addiction, and he's going really bad. We've been trying. My question is, do you believe, as a clinical, medical, mental health certified professional, do you believe medication, okay, can cure? Because from what you're saying, there got to be a fundamental issue, right? Something, maybe the person is jobless, the person is not married, no love in their lives, they're stressed, they have zero. Like in my briefing, I said spiritual health, social health, physical health, environmental health, all these things I believe play a role in a person's well-being, right?
Mhm.
And essentially their mental health. So I have a problem with medication taking care of issues that are real issues in a person's life. They need a job. They need a place to sleep. They need food on the table. How does medication cure that?
Well, medication don't will not solve that for sure.
Right.
But that's why you need to seek for help. Because if you need a job, you need to apply for jobs.
They might not know, like, so if they come to you, if a person is, what are the steps of, we've already covered it, but it's very interesting. How do you diagnose? Like you've said it, but it's a follow-up question. During the diagnosing process, what are the steps that you guys take
But
to
most of the
ascertain this person needs this or needs that, or you just give them medication?
no, 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 no. Remember, it's not always medication. In
Hmm.
some cases, medication can be paired with therapy. But in some
Okay.
cases, just being able to have somebody to listen to you, it makes a difference. So it just depends what you're dealing with.
Okay.
And like a lot of the people, like if you need a job, but if you cannot find a job, then we have to talk about why you cannot find a job. Because if it's something that you are liking, then you can be encouraged to just see what it is. Because the thing about it, we cannot always tell you like what you need to do. It's about just finding out what's going on with you, and it's about the diagnosis. It just depends. Like I said, it's just about grouping just a whole bunch of things. Just checking, looking at your behavior, looking at just like your mental being, looking at your actions and how you relate, how you're dealing with others and things like that, and how you feeling, your moods and think. It's like there's so much you have to include like everything.
Okay. Good response there, my dear sister. We're going to jump to question number 7. What is PTSD? The post-traumatic stress disorder. There seems to be so many people being diagnosed with PTSD. How long can one experience PTSD, and is it also treatable?
Yes, it is treatable if you seek help. But PTSD, it usually happens while dealing with trauma. It is treatable. It's just I think it's just like a lot of the time, like the reason why I went with NLP is just because it helps faster. Because a lot of the time PTSD sometimes will just start with pain, like physical pain, like just headaches, migraines, and most of the time you may not even know it may be related to that, you know. So it's just like it is treatable if you seek help, but a lot of the time people don't understand, and then it comes in many ways,
Mm.
like everybody show it. A lot of them, they kind of like just withdraw, and some of them don't show emotions anymore, or they would rather be on their side and be on their own, like mentally they kind of like it's kind of like they're living in their own world. And I think that with PTSD, it's important to know the triggers, because we don't know what caused the PTSD, because sometimes it's due to, trauma, like a war trauma, or sexual abuse, or, accidents, or anything that could alter your brain, actually. So I don't
Hmm.
know. It's just so much.
That's
And you're right, though, because a lot of the time, people, people, a lot, like, especially in the military community, a lot of the time, when you go to war and come
mhm.
back, you deal with a lot of the military people are diagnosed with PTSD. But the thing about it, though, it's not just military people. PTSD can like anybody who have um,
Experienced.
just
Oh, going.
experienced trauma. And
Okay.
trauma, the thing about it, trauma can be different from you to me. It's
Okay.
just anything that cause trauma into your body can cause that. So,
Awesome.
um,
Awesome response. I have a follow-up question to this one. This is interesting question. It's a follow-up question. Does the subconscious mind, okay, have anything to do with PTSD? For instance, when you're asleep, right? ca- you experience a terrible dream in your sleep. While you're sleeping, you went through a very terrible, traumatic experience in your dreams. You wake up and suddenly you begin to become afraid. And can you explain what is going on at that point in a person's mind? After I know you have a degree in neuro linguistic programming, and I know that has something to do with y- mental health.
yes, it does help. I'm
The
certified with
Right.
neuro linguist programming. Yes, I think like when you go to sleep,
Hmm.
your subconscious does not sleep.
Hmm.
So it's like everything you still, I mean, your subconscious is still aware of what's going on around you.
While you're
So
sleeping.
yes. And you say that if you're having nightmare, can you repeat?
If you have a terrible dream and while you're sleeping, you experience something terrible that was almost like real. People have all kinds of dreams they encounter, and you wake up, you're afraid. Okay, you're afraid of what you experienced, but your whole day you begin to think about that dream, and does it have an effect? Because subconsciously you experience that right while you're asleep. Does it
Yes.
have an effect on your ability to be diagnosed with PTSD at that point? Is that when you?
Are you just talking about just a dream or a nightmare, or is it like
Yeah,
something that's
because
consistent? Because usually PTSD is a mental condition that is a result of series of emotional and physical reactions in
for
individual.
example, I know some people that have had sexual intercourse with while they're asleep with spirits. Strangely,
Oh,
I've heard about. I know I've heard a lot of stuff about people that have encountered nightmares with evil people. I don't know if I'm not a spiritualist like that, but I've heard all kinds of experiences people have in while they're asleep. And you just admitted that when you're sleeping, your subconscious mind doesn't sleep. right?
Mhm. Yes.
Does such experiences have an effect, or is there a determining factor for you guys doing your diagnosing to affect somebody's brain or mental health?
Well,
It can it affect you while you're asleep?
I think what you're talking about most of the time you see. I know you hear about it in Africa
Hmm.
or things like that. Because
Hmm.
I don't, you know, here in America you don't always. I mean, it would be hard to kind of deal with that. But I think it's like when anything that is affecting, that is bringing fear in your life and affecting your well-being, has to be dealt with. So I don't know about. I'm trying to still
I
understand
mean,
what you
some
exactly
people
trying
can
to
have
say.
a dream of a scary dream. You could have something not necessarily spiritual, but you could have a dream, or you were in a war, or maybe
Mhm.
you saw a dead loved ones that it couldn't have been scary, but like the dead loved ones appear to you in your dream, and it's been haunting you. Maybe somebody who died came in your dream and you experienced an awful dream. We call it bad dreams, right? You've not
Mhm.
heard about bad dreams.
Yes.
And yeah, and my question is, does that have an effect on your mental health? Does in your diagnosing, would it be a factor to look at in determining PTSD?
No.
Subconscious, no? Okay.
No, I don't think so. I mean,
Okay.
because a dream, especially like from to me, a dream is just a way like God speaks to us sometimes.
Hmm.
And if it's a bad thing, if it's a bad dream, then you just have to kind of to ask. For me, it's like I would just pray about it and let's ask
Okay.
God to show me more. So I don't
Right.
think that every time there's something going on, that you can just think that, oh, it's mental health, because it's not always mental health.
It's also
Illness.
spiritual health too. It could be
Well, it
spirituality.
is also spiritual because it
Yes.
depends how it affects you. I think it
Okay.
just depends how it affects you. So, but I think, but you can train. You can train your brain to do a whole bunch of things. But like I said, like where even when you're sleeping, you have to like you have to be aware. You have to be
Hmm.
very careful about like what you watch before you go to bed. I mean, that's not even psychology. That's just, like they tell you to just be careful what you surround yourself into. Because if you decide to watch a movie,
Hmm.
like like where everybody gets hurt, you're gonna go to bed. That's gonna continue, kind of like you're gonna continue seeing that into your mind. So, and that you cannot call that mental
Your
health
subconscious
illness.
mind. Okay.
Yes, because that's just consciously there's some things that we have to do. The subconscious, I think, is more like because sometimes there's a whole bunch of things. Let's say like you can be young, like sometimes
Hmm.
there's some children, they can fear dogs, but they don't know what it is. They don't know what happened.
Hmm.
They never even have to be around dogs, but when they see a dog, but then when they see a dog, they're just so scared. And sometimes, you know by doing
Yeah.
NLP, the neuro linguistic programming, you can
Hmm.
find out why that fear is there.
Okay.
You know.
That's interesting. That's interesting. Again, we're going to go to question number 8. You're doing amazing. I'm enjoying this. Question number 8. Again, on the PTSD, is it possible for two people to experience the same traumatic thing, right? Go through the same traumatic experience, but only one be diagnosed with PTSD? For example, some cultures in Africa practice FGM, female genital mutilation. There have been cases where some will show signs of PTSD while it became apparent in others. Some will show no sign at all. What is your take on this?
For me, I think it just depends about how resilient the person is, and that's about it. Because it's like, you know, some people deal. But when things happen in somebody's life, people
Mhm.
react differently. So it just depends how resilient you are. And I think that's just the difference between the person who's diagnosed and not diagnosed. There's no right and wrong. There is really no right and wrong. But I think it just, you know, it just depends how resilient you are. And that also affects a lot of just the things you've been through in life.
Mhm.
And like I said, we both from Africa, and we've been through we've seen a lot of things
Yes,
that,
absolutely.
if somebody from here sees it, they'll be like, oh my goodness. But a lot of the time we've seen it, but we moved on with it. We moved on and we are okay. But then sometimes though, some people don't. Some people don't cannot move on. And I think that's when, like I said, there's no right and wrong. But I think it's just depending of how your resilience. So,
Hmm.
and yeah, and I,
Interesting. So your ability to move on from a bad experience or a traumatic experience is a form of therapy or healing. Because just because you moved on, does that mean it does not exist? You don't have PTSD? Because sometimes something triggers. Like I grew up in war, right? I'm a victim of war. I saw terrible things, very terrible things that I don't want to go personal.
mhm.
But sometimes something triggers it, and I uh, I become emotional for a minute when I see some of those things. So does PTSD ever goes away? And how long should an experience have occurred? Can a person experience something in their childhood and still have triggers in their adulthood?
It's possible. And I mean, sometimes treatment can take, for some people it can take 6 months, to some people a year, to some people longer. And I really think that this is, we are all unique. So it's not just one treatment fit all, you know. And I think for not everything is PTSD, and not everybody who had been through trauma had been diagnosed with PTSD. But I think it's more like, if it's something that, if you can recognize that it's affecting your life, because a lot of the time, it's very hard to live with somebody with PTSD, because lack of emotions,
Mhm.
disconnect. When you live with somebody who's completely in their own world, they are completely disconnected from
Mhm.
you. It breaks families. It makes a lot of changes.
Right.
And I think it's just like, you know, once again, about how resilient you are. And there is not what just one treatment fit all.
So it's individually what you can take, your resistance, your resilience, your tolerance in.
Yeah, and
Agree.
sticking to treatment, because
Okay.
you have to be consistent, and also you have to accept what you're going on. You have to, do research. You have to, just watch your self-esteem in general. But you have to accept, because if you don't accept and recognize that there is something going on, then nobody's gonna make you, like, it doesn't matter what kind of diagnosis a person gives you. But once you don't accept, then you will not do anything to better yourself.
Good. Good response there. We're gonna jump to question number 9. Two more questions. Um, I've heard people say that there's a bit of craziness or some form of mental disorder in everyone due to how stressful and challenging life can be sometimes. Can people be mentally ill without knowing it? I know you've touched on this, but what's your take on this?
Yes. Yes, because a lot of the time, the the person reality may not be your reality. So you can say whatever you want. It's like, if they believe that they are a lion, you can tell them whatever you want. that they think they're lying. You cannot change that. So it's like, and if you don't, you can tell them that, okay, there's this going on. You can also be in denial and don't accept it. So I think that's just like some people can, yeah, there are a whole bunch of people that walk around
That have mental illnesses,
that
but they
have
don't know
mental
it.
illness and they don't know. Once again, it just depends of the level of stress you're in. Because if you're having a mental illness and you're surrounded by peaceful, like you live in a peaceful environment, you may continue living like that and be okay. But if you live in an environment when things are chaotic, it's gonna show faster, you
Faster.
know,
That's interesting.
anxiety, fear, it's
Yeah.
a whole bunch of things, depression. So
Mhm. Interesting. Good job there, my dear sister. Um,
okay.
Last question. Finally, what advice would you give to families, friends, and the community at large to help in dealing with people diagnosed or appear to have some form of mental illness? What perception should we adapt towards such mentally ill people? How do we go live with them? What's your professional advice?
Well,
Mm.
I think for me, I just want to just say that mental health does not discriminate, first of all. So we have to be kind to one another. You have to be kind, and we have to be able to talk about all the different signs of mental health. And you have to be able to to just understand the symptoms. We have to be able to just check on one another. And I always say, especially to mothers, I really believe that as a mother, we like mothers have a lot of intuition. And if you think that there's something going on with your child, no matter what anybody says, just keep trying. Make sure that you don't give up. Because sometimes it's easier to just go somewhere that ask you a whole bunch of questions and then they're like, okay, you're diagnosed with this. But if your intuition tells you that there is something else going on, just keep going and just keep trying. If you can see one therapist after another, but just keep trying until you know you're more clear about whatever is going on. So
Hmm.
and I think it's just like, I know,
Yeah.
and I think of mental health too. I would just say that, what we shouldn't, like, while dealing with mental health, especially in your household, you should not take it personal. You should not take it personal, because the person doesn't know. Sometimes they don't know what they're saying, or the thing that they, like I said, that sometimes the reality is not where it's supposed to be.
Hmm.
So don't take it personal, and just, it takes a lot of patience and persistence to deal with a loved ones with mental health. And I just think that,
So what
communication.
right, what advice would you give to folks in Africa that have this is a follow-up question, that have people in their communities that appear to be clearly mentally disturbed? They're sadly called crazy people or lunatics. The majority of time they're homeless or walking the streets. What advice are you giving to the government, the people of Africa, in treating or responding to such persons that clearly appear to be mentally disturbed and homeless and wandering the streets of Africa? As a professional, what
Well,
talk look in the camera and tell Africa how to treat these people, what they need to do.
most of the first of all, they need to have people needs to know more about mental health, because in Africa, usually when somebody is dealing with mental health
Mhm.
illnesses, they're quick to say it must be witchcraft. And a lot of the
Mhm.
time, it's something as simple as just a lack of sleep or just the stress, everyday stress. So, and there's nothing to be ashamed of. But I think that, like over here in America, you have options. There are a whole
Variety of
bunch of,
option.
yeah.
Uh,
But
Exactly.
in Africa, we don't, because mental health, is kind of neglected. So there should be more, you know, maybe mental health should be talked more about, and it should be more classes.
It's not always witchcraft.
Education.
It's not just
It's
the
not,
person
no,
has,
it's not
yeah,
always. It's not always.
yeah.
It's not always. And I think, but like I know in Africa, well, we need in Africa they need like a lot more help with just any type of health facilities will help, more
Yeah,
doctors will
environmental
help,
health, physical health,
environmental, yeah,
spiritual health.
all that,
People
yeah.
are not aware of these things in
But no,
majority.
because I mean you can say whatever you want, but it's like if you in your environment something is seen one way, it's hard to get through them. But then mental health illnesses is nothing to be ashamed of. And there
Right.
is hope. There is hope.
I like that.
There is
Hallelujah.
hope. There is hope. But once again, it's like you cannot do it alone. And you need treatments, you need, therapy, you need, sometimes medication, whatever it takes. But you can have a normal life after
Yeah.
dealing with mental health illnesses.
Awesome.
Then
This brings us to the end of another amazing edition of the Talking Drum Show. My dear sister, thank you so much for accepting to do this. I'm
thank
proud
you
of
so
you
much.
as a friend for coming on here to throw light on this very, very important topic. I'll give the opportunity to give your closing statement, and and then I'll see you later. So say goodbye and give your final statement to the followers. Thank you.
Well, I just want to thank everybody and just encourage everybody to seek help. Seek help if you think and believe that you're dealing with any mental health illness, and you shouldn't be ashamed of it. It can happen to anybody. So that's about the only thing I can say about that. And thank you.
Awesome. Thanks for having you, my sister. Thank you for coming. Have a good day.
Thank you. Thank you so much.
Bye. My dear followers, this brings us to the end of the seventh podcast of the Talking Drum Show. How aware are you of your health? Your environmental health, your physical health, your emotional health, your social health, and most importantly, your spiritual health. How aware of you of these? Mental health is real. Mental health is real. Let us treat our loved ones that appear, our community, our people that appear to have some form of mental health, like we heard from the professional. Treat them with care, treat them with love, treat them with compassion. That they may not, because majority of the time it's not witchcraft. Especially, I'm talking to the folks in Africa. You see somebody wandering the streets, abandoned. It's not necessarily witchcraft. They need help. They need love. They need compassion. Have a good day. And thank you to my subscribers. Those of you that were loving enough to hit the subscribe button. I want to say to you, thank you. Thank you for subscribing. Thank you for loving and caring for Talking Drum Show. Because you may not have money to donate by starts, but you can subscribe, you can share, you can comment, and you can watch the show live. Thank you. Have a good day. And I'll see all of you next week, Saturday, for another amazing topic. It's a powerful topic next Saturday. Don't miss it. See you and have a beautiful day.